Good afternoon, and thank you for attending the session that asks, do we need AI to serve our customers better? I'll be joined by my colleague and fellow pharmacist, Regina Cowie, and we wish to thank Cos. He's always there, but today he's just gone out for a second, and the organising committee for putting on this event every year and helping us all get that little bit smarter. So the learning objectives for this are there, but to begin with, what is this thing we call service? Put simply, it's the work done by someone to help someone else. So why is good service so important? Well, when you're a consumer, when you need service, as a customer, you know how great it is when you get good service, and you know how terrible it is when you don't. A recent survey reports that 1 in 10, or 10% of interactions, are having very poor service. Now that number's improved since COVID, when it was 25% of all interactions were poor service, and we're doing better than the global average, which is 14% of all interactions were very poor. Still, poor service costs a lot of money, with the indicating survey that 41% of people will reduce their spending with you after a poor service experience, and 14% of people stop buying altogether. If you take those stats, you can estimate that $74 billion worth of sales are at risk as a result of poor customer service. The good news is that in that survey, 2 in 5 people believe that AI can reduce the bad service experience and delight your customer. But they also noted that the service can only get better if AI is used along with prioritising the human interaction, which is, as we know, often needed. That is, a tech-only response will not work. So, last time we spoke about AI at this conference, it was, 3 years ago at APP. We introduced the idea of AI to pharmacy, and we talked about adding AI to our Fred Dispense Plus product. We had Microsoft here talking about all this technology. So what's happened since those 3 years, and why discuss AI again today? In short, it was this thing called ChatGPT, a tool that enables normal people, not just technical boffins, to be more productive using AI, or in particularly what they call generative AI. So can I see a show of hands who uses a product like ChatGPT in their business regularly? What about writing at home, writing messages or doing things at home? Cheating when you have to write a poem for someone? So you can see a lot of people have had a look at ChatGPT. So what about those that haven't? How about we look at this little example that you might find in your business? In this scenario, the pharmacy has been asked to give a 30-minute talk to the local Probus Club on the topic of medicine safety. So you'll need a PowerPoint presentation to form the basis of the talk. Normally, today you would have gone to Google and find some information in there, and then you'd sit down in PowerPoint and spend all your afternoon or evening preparing the slides. Most likely, as most pharmacists, you'd need to do that out of hours because it's too busy in the pharmacy and it'd eat up your precious time. But what if using AI was able to get that job done faster and possibly even better? So let's have a look at ChatGPT helping us do this task. Well, the first thing is to go into ChatGPT, and for those that haven't, you've got to be careful. There's a few fake ones around, so make sure you go to chat.openai.com, as OpenAI own ChatGPT. In this case, as you can see up here, I'm using the free version, but if you want the latest data, you should subscribe to the paid version. So typing in just a few prompts about what I want to talk about, you can see how quickly ChatGPT gives me a broad outline of my presentation. So that's nothing new. I wasn't that startled with that. Everyone knows how to do that. But I also wanted to cheat and get the slides made for me. So I swapped over to the Microsoft product, and they have their version of ChatGPT called Copilot. And in Copilot, I can create all my slides automatically using AI. But to do that, I first of all have to get it into Word, because they need everything in Word in Microsoft. So I have to do a little copy-paste. I just copy all the content directly out of ChatGPT, open up Word, paste it in, and save it. I then go over to PowerPoint, and I have to have the version that's got Copilot paid for, of course. And in here, I just open up Copilot, I click on the ChatGPT function there, and I copy my file in there. And then the magic starts to happen. It starts to read my Word document, taking out the presentation guideline that you saw before. You can see that now it's working through, analysing that information, and it starts to produce my slides for me. Not only does it do my slides for me, but it starts to say, all right, I'll go and get the design for you, I'll go and get some images for you, and then it finishes by adding the speaker notes. So not only will the introduction person be made redundant by this technology, hopefully I will be too. So the draft of the slides and the content is ready to go. The whole talk was produced from idea to finish in under 3 minutes. Of course, you'll need to review the draft slides and personalise the content for your style and the audience. And you need to remember that AI-generated content might not be perfect all the time, but it does give you a great head start and can give you some of that precious personal time back. So with that introduction, I'm going to hand over to Reg to continue the presentation. Regina?
Thanks, Paul. Thanks, everyone. I bet the question you're asking now is, why didn't we just use ChatGPT to do this presentation? And I'll let you think about that one for a moment. But I'm here to talk to you about AI, and I'm sure you're all aware that it's been around for a very long time, but the first instance of AI was in 1956. And here's a fun fact: the fax machine was 1964. So AI's been around a lot longer than the humble fax machine. And I know there are some in the audience who will recognise the name Garry Kasparov, who's the Russian Grand Chess Champion, the Grandmaster they called him, who was famous for playing chess, and in 1997 he was beaten by the first computer AI, IBM Deep Blue. So it's been around for a very long time, but it's just making this big progress in healthcare and in pharmacy, as we're seeing. From where it first started in its humble days in data and medicine storage, we're now looking at medical histories, medicine stock on hand, and more management-focused efficient AI in our pharmacy space, such as drug discovery, formulation, improved drug delivery methods, and polypharmacology. And Jobs was famous for saying the phone is like a bicycle for the mind and AI is the rocket ship. So it's pretty phenomenal. We're now in what we call the second generation of AI, and that's generative AI, as Paul briefly mentioned. And as that name suggests, this is really about generating content through AI, through audio, visual and text. So we've just seen how efficient AI is through Paul's demonstration, and it's hard to ignore how amazing this tool can be. It can help draft up rehabilitation plans and recommend treatment plans and management plans for chronic diseases, and helps us with pharmacology. We'll talk a bit more about the risks associated with AI, but I want to touch on, obviously, first, the opportunities. So are we ready for AI? We definitely are. It's here. We can't ignore it. We all know the AI healthcare market in 2002 was valued at $1.28 billion US, and it's growing up to about circa 22 billion by 2030 to 32. We need to be AI ready because it's here. AI is the end goal. Machine learning is how we get there. Machine learning is the data, the computer data that we feed into the system, which makes it smarter. AI is in everything we do. Every news article we click on gives us a preference for the news that we need to feed and read. Every product that we want to purchase, again, same thing, creates a preference for what we should be buying. All these tools are making AI smarter. However, to build these truly intelligent machines, we need to teach them cause and effect, and we need to teach them right from wrong, and I'll touch on this a bit later on. The reason that we say we're at the start of this AI journey is to understand where AI sits currently and what we need to do to maximise the use of AI and minimise the risk. At the moment, AI is what we call a divergent stage, where everyone is using it, feeding it endless information, and it's getting smarter and the potential is endless. I've popped an image up here. These are a number of companies that are currently focusing on AI. Lots and lots of them. Most of them over the next 4 or 5 years probably won't survive, and they'll be really quite a smaller number. So with AI in this current divergent stage, we're calling it pushing the envelope. We're doing things, taking risks, we're making these tools work for us. But as we know, technology does settle down in some sort of shape, and who knows when that will be over the next few years, I'm not sure. But then we move into something called a convergent stage, where things start to settle down, and AI will move into this scalable, very highly reliable, efficient and accurate tool. So what are the clinical AI improvements in pharmacy, and what do they look like? The key message here is to use AI and automate where you can. If it can be automated and machine learnt, use it. It allows you to spend more time with your customers, and that's the whole theme of this conference, is how do we get out there, scope of practice and serving our customers better. There are lots of new emerging tools. One in particular I wanted to mention was the emerging AI script transcription tool, which is currently being used in prescribing platforms. No longer is the GP typing on the computer while they're consulting with you. With consent, the AI tool is able to record the interaction and scribes the patient notes. It then spits out a recommendation and care plan and pharmacological plan for obviously review of the clinician, just making that really seamless engagement possible, and this is here and now. There are currently AI tools that assist patients from interpreting lab results and summarising wearable data and translating complex medical terminology into language that they understand. As we know, health literacy is not great. An example of this is a product called Abridge. Remember that not everyone has the same health literacy as we do as pharmacists. There are over 1,000 AI medical devices currently going through FDA approval, and there are obvious lots of efficiency gains. Oh, sorry, that's just gone through. In preventative healthcare, diagnostic healthcare and reporting, and in fact many HMR consultants are using AI to assist them with report writing and care. AI can be used to create templates, health messages, presentations, etc., as we've seen. So what are the business improvements that AI can deliver? Technology improvements are normally associated with a business as a cost. What we want to encourage you is to look at innovation and technology as a part of the future, not as a cost on your P&L. What we know is that AI can be used to improve pharmacy workflow and efficiencies, and as I mentioned before, automate those tasks that can be automated. AI is very useful in inventory management. As a retail pharmacist, imagine being able to predict what your patients want to buy, stocking those products, making sure they're in stock, and using a personalised software to deliver a care message to them. With the power of AI-powered data analytics, a patient's future drug purchases can be predicted and stock procurement decisions quite sound. There are programs out there like that, and there's an AI company called Blue Yonder, which was developed for Otto over in Germany. They're an online catalogue retailer. They've got a tool that can predict these sales up to 90% accuracy, which is pretty amazing in this divergent stage currently. The result was that their delivery schedule was reduced and their inventory management was optimised. There are other programs out there called Liberty, Windfarm, also again inventory management can use AI to optimise that. There are obvious business growth opportunities in areas such as HMRs, as I've touched on. AI absolutely lets you spend more time with your customers and improves those cost savings through time and effort. I really love this picture. This is a photo of an AI robot in Turkey, in a pharmacy over there, where they've got significant workforce shortages. They're using this AI bot to answer common questions, triage, what do I do? I'm here for my flu vaccine. So using AI at every opportunity. But the piece that AI is lacking is the ability to be emotive and feel emotion and respond to the patient with that human element that we're so good at. This article headlines that Google has better bedside manner than human doctors and provides a better diagnosis. What's alarming is that we need to ensure that pharmacy is not in that headline. We need to ensure that we use AI components that complement the delivery of the service and not look at doing it better than humans. So as we know, AI can transform and has transformed sectors such as the healthcare and pharmacy, and it's being built ones that need to be smartly interacted and not meant to be independently intelligent. So how does AI work in healthcare? And I thought I'd just put this really quick diagram up. It's quite simple. When we refer to AI, it's looking at aspects of all your data on that left-hand side. So your lab tests, x-rays, CT scans, etc., your pharmacy history, what you've been taking, any allergies, and your DNA genotype. Then the AI algorithm receives all this data. It receives all your data, but it also has lots of data from journals and literature. And then it analyses the data, and then it forms patterns and predictions. And then it can also predict, obviously, those potential contraindications, interactions, allergies, etc. It then produces an AI interpretation from this data, a management plan, a diagnosis, treatment plan, decision support tool, prognosis, medicines to use, etc. Obviously all for your review, but making it quite a seamless process. We're only at the start of our AI journey in pharmacy. But what does the future look like? Well, the future's pretty amazing. We'll have more qualitative decision, precision-based medicine based on your genotype, individualised health monitoring focused on an individual health needs, prediction, prevention and early detection of diseases. AI-developed treatment plans include pharmacology, will definitely be used, and a great example of this is the current system out there called IBM Watson for oncology, which has exactly what I showed you in my last example, a wide range of patient data, which then spits out a logarithm and helps making informed decisions around oncology management in that space. Lots and lots of opportunities, but it would be remiss of me to talk about opportunities without briefly touching on the risks associated with AI and just making yourself aware of what you should be asking and questioning in this space. So before you use AIs with every other system you have in your pharmacy, make sure you take into consideration and ask yourself some of these questions. Has the tool adequate transparency? Is it reliable? Is it fair? Has it some accountability? Are there monitoring systems in place? Are there policies and procedures? What are you using it for? Does it complement what you're doing? Can it make things easier? Does it save you time? Does it give you that alternative opinion you're looking for, especially with the use of generative AI? And I'll touch on a really quick example here in the software space when we hopefully use AI to help code and we build code. What AI tools do is lower that barrier of entry, enabling less technical people to jump in there and use the code that you're using to build your software to create malware and cyber attacks. So it's just being very, very careful around what you're doing and how you use it. So make sure the purpose and value, your use of AI is at its core, and just be aware that when you use any AI tool, ChatGPT, Copilot, and anything similar, is it your data? When you input anything in there, make sure you've read the T's and C's, you understand your licensing, if you have paid for it, an up license, is it still your data on IP or isn't it? So just be very careful. So on that, I'm going to hand over to Paul to discuss how we make AI happen in pharmacy.
So thanks, Reg. And having seen some of the great AI use cases up there, you need to think about what do we need to do to make AI work in pharmacy. The first thing we need for success is data, and we need lots of it. To predict the future, AI needs to know about the past, and the more of the past you can feed your AI models, the more success you will have. For example, when Reg was talking about AI-based inventory ordering, the tool that aims to predict what stock you should purchase, the AI would need to know what your past ordering and sales history was, and what other factors drove that result. For example, did the weather over that period alter your sales? Or were there stock shortages that changed your choice of what you ordered? So to succeed, the AI model would need to access sales and ordering data from your system, and maybe weather predictions from the BOM, or stock shortage outage information from TGA or the wholesalers. But data access is the key to AI success. Without data, you can't build those successful models for those accurate predictions. While we need data for AI, we must confirm that we have the rights or permissions to access that data. New privacy requirements are increasingly making it difficult to share data, even when the person is not identified. So once we've identified what data we want for our AI models, then the question is, how do we physically get to that data? How do we safely and securely share large slabs of data across systems? How do we make sure we've got the correct APIs or links to each of those systems? And how do we make sure these different systems work together for better customer outcomes? Robotic dispensing systems are a great example of systems working together for a better customer outcome. We all know the speed help that a dispensing robot gives us in the dispensary today. And today we're using an international standard called WWKS2, that must have been designed by a robot, that name, for a standard which enables some of our partners, such as BD and soon with Willac Consus, to bring more and varied robots to our market in Australia because we're using an international standard. More interesting is the newer developments of the health standard for joining health systems together using APIs under the banner of FHIR. FHIR stands for Fast Healthcare Interoperability Resources. So how about we have a look at an example of somebody using FHIR APIs to get the best results for their patients. In this case, the patients are our brave and fearless members of the Australian Defence Force. Yes, they get sick at times and they are often looked after by the ADF. The ADF has recently moved to update their health IT system known as the Health Knowledge Management System, or HKM. In doing so, they chose over a dozen different software providers that have been chosen for different specialty areas of practice. For example, the ADF chose to use Fred Dispense Plus for the pharmacy system. They chose a product called MediRecords for the clinical practice or the GP system. And they chose a product called Titanium for the dental system. All these systems need to work together to share data for the members in real time, safely and securely by using and developing the FHIR standard. Using FHIR, the Defence Force now has an entire view of all the data from all the systems. So in the future, if Defence wish to use AI to achieve further outcomes for their patients, they can. All the data from all the best systems are all being put together to deliver one great health outcome for our Aussie soldiers. This is a great example of how connectivity standards are used to achieve better outcomes for service. So how does that example translate for community pharmacy? Just like the Defence Force, we realised to get a better customer outcome, you need to use the best IT set of solutions. Like I would hope that we were the provider of all those solutions to you, to be honest, that's not possible. No one provider can provide all the solutions you want to use. But all of this best of breed approach only works if the systems can safely and securely work together. So in pharmacy, the central platform of truth is always your dispensing software. The dispense system creates the majority of your clinical data, and it's critical for most of your patient journeys. So when we designed our new Fred Dispense Plus platform, we built in secure APIs from the very beginning. For example, we're now using the FHIR standard to work with pharmacy groups who have chosen multi-store POS solutions from other software companies, but still wish to use Fred Dispense Plus for all their clinical and dispensing needs. But along with the technical linkages between providers, we also need to formalise our contractual arrangements so we can get the service and support that you need so you can support your customers. And I'll ask Reg to come back to explain that process a little bit more. So, Reg.
Thanks, Paul. So this is really quite simple. We have something called the Fred Marketplace. This is where you can go, it's your one-stop shop, it's our hub of all of our partners. This is just a really quick snapshot of some of the partners, and I'm going to go into a little bit more detail on a few of them. But the hub here is all about integrations and enhancements in your pharmacy, making technology work smarter for you. So Lisa quickly discussed the integrations and importance of integrations, and this is really about making things simpler in your pharmacy. So I just wanted to touch on Strongroom AI. They use innovative AI at every opportunity. Strongroom is one of our really key partners in this space, making sure that all of our platforms work seamlessly. Another example is Fluga. Fluga is an online patient booking platform, strongly integrated with MedView Flow, which is our workflow tool, a great partner in this space. Storby, an e-commerce platform partner. If you have a website, this is your partner of choice. All of these work seamlessly with all of our Fred Suite software. Modius, they don't need any introduction. They're the electronic DD book, again working seamlessly within our software. Nostradata and Informacy, your data and analytics platform, again works seamlessly in our partner space. And Tyro, which is our sales and health. So head over to the Fred stand if you want to know more about our partner program, but rest assured that all of our partners have been tried and tested, and they work with all of our software, making it easier for you to do business in your pharmacy. Thanks, Paul.
So as we head towards the end, I normally give an update on where we're at with e-prescriptions. And it's a bit different this year because Fred now operates ERX Script Exchange under a government contract that's known as the National Prescription Delivery Service. So that's great news for all of us, that the e-script costs for PBS prescriptions, including the SMS fees for the doctors who choose not to use SMS because they thought they had to pay for it, are now paid for by the government directly to ERX, and they aren't part of the pharmacy agreements any longer, so they no longer eat into the agreement funding. So for you, it's obviously less paperwork, and for us, it's certainly more certainty on how we can invest into the future in the ERX platform. We all know that there's more work to be done, and we're working with the Department of Health and the Australian Digital Health Agency to further improve the e-prescription ecosystem, especially around the areas of the MySL or the active script list, that there's certainly things that we're all looking forward to getting into market over the next 12 months. But statistically speaking, 80% of all dispensing currently is digitally assisted. That means that we are all typing so much less than we used to. 20% of all dispensing are now totally digital, no paper at all. The question is, how can we grow that percentage even further? How can we tackle some of the ongoing issues that come from having a mixture of both paper and digital scripts in our workflow? The daily workflow in the pharmacy is moving on from the simple scan of the e-scripts into a queue. As we've seen and we will continue to see over this conference, we are managing many more work items, including clinical bookings and a great suite of vaccinations. The good news is, again, I'm seeing a number of other software companies building new workflow tools or adding to existing products. For example, one of our partners, Script, is doing some great work in workflow management, and there are others, of course. At Fred, we continue to invest in our workflow tool, MedView Flow, which is currently operating in over 3,200 pharmacies across the country. One of the new MedView Flow features is the ability to send SMS messages directly to your customers, but keep the history of those interactions within MedView Flow. So make sure you check that out during the exhibition. But in observing pharmacy today, I see one area that continues to be stuck in the paper world, and that is the humble old plastic prescription basket. The scene on this slide and variants of it, I'm sure that's not your pharmacy, looks the same as it did when I qualified a couple of years ago. Yes, the name on the baskets of the generic companies have changed, but apart from that, the paper, the scribble, the fluoro, the messy bits of paper, a mixture of digital and paper scripts or digital scripts that become paper scripts, you know how it is. The pharmacy basket remains totally disconnected from the digital world. Can we make that better? Especially when you consider that the workflow tools like MedView Flow already know about what's in the order. How can we bring the pharmacy basket into the digital age? Well, I searched the world, including using AI tools, for a solution to this problem. Surprisingly, there isn't one. So I created a possible solution and set about applying for a patent so I could bring it to market. In the end, you will tell me if I'm going mad or not. But can we go from this mess to something like this? So I'm introducing the MedView Flow Digital Basket. We are connecting the physical world of the prescription basket to the digital world of the advanced pharmacy workflow. So how does it work? I actually have one here. Hang on. Oh, yeah. It's not a big upgrade, is it? So how does it work? Let's have a look at it. In the first example, let's have a look at remote scripts. As we know, these are the scripts that patients are sending in from apps, and that's growing every single week, and they expect it to be ready when you turn up. In this example, the ordering step doesn't change at all. The patient uses their existing app or a web page to send you their prescription order. But once they send you the order, the good stuff happens. The waiting empty digital basket starts to flash as it receives the patient's order for you to dispense. It is signalling clearly to you and to your team that there's work to be done. Once you've dispensed the item, we send an SMS automatically back to the customer to say the order is ready, along with a link or a unique QR code for them to come and safely pick up their order. When the patient comes in to pick up the script, we scan that QR code on their phone, and magically the basket on the shelf starts to flash, and we can safely and accurately give the right medication to the right customer. Easily improved workflow for you and your patients. So let's have a look at it working. All right, here we go. Let's see if we can make... I don't do live demos anymore, you notice that? Stopped about 10 years ago. So let's take this one and see how we go. So just like today, when the patient gets their SMS e-script, they just click on it and do what they do. Like if they want to do it remotely, they can click on the how do I get the script or open up their app. In this case, they're using the MedView Patient Connect to send the script into the chosen pharmacy. So for a pharmacist using MedView Flow, that script just turns up in the queue as it does today. But unfortunately, half the time you don't see it or notice it's there until the person comes back in. The difference here is the empty digital basket sits waiting for orders to arrive. The LED on the digital basket starts to flash to indicate there's work to be done. In this case, you can see the order is here for patient PF and when they're due back, which is 12:37 today. The pharmacist then goes and dispenses the script the same way they do today through their dispensing software. And when the script is dispensed, the digital basket automatically updates to say the basket needs to be checked. You can see that the yellow flashing light, the colours aren't very good in the video, I apologise, flashes to indicate that the basket on the bench needs to be checked. The pharmacist can check the script the same way they do today, or, as many have done, remove the checking step from their workflow because they find it too cumbersome. In this case, you know it's true. In this case, I check the script using MedView Flow, and once the script is checked and marked as out, ready to go on the shelf, as I said, we send out an SMS back to the customer to say, your script's ready to come in, and when you come in, we just stick it on the shelf anywhere. We don't have to put it in any particular spot because it's chaotic. No A to Z, no 1 to 10. Just put it anywhere because the lights will show you where it is when it's run. So when the customer arrives at the pharmacy, they click on the pick up SMS, they show the team the QR, they scan it at the front counter and the basket starts to flash. So once the basket flashes, you know which one to go pick up and you can hand it out. In this case, it's flashing red because in the check-in step, the pharmacist said that they wanted to see the patient before it was handed out. So the little pharmacist on the basket says they need to be seen, but the red light says they can pick it up, but they can't hand it out till the pharmacist has seen it. So once the basket is handed out, the digital basket resets itself back to empty and it's ready to go again. This process just repeats over and over, a very simple process. So what about the normal scripts that come in the door? Well, a similar approach. In this case, the customer has 2 SMS scripts sent to them on their phone and they're scanned in the score queue by the pharmacy assistant. The customer needs a spacer for their Flixitide, so while the assistant is adding it in, they put a note into the digital basket to say they need a spacer. Nothing new here. There is a new step here where they assign the empty basket to the order by simply scanning the empty QR code on the front of the basket, and that assigns that work to that basket. The digital basket starts to flash to indicate it's accepting that new order for those 2 items, and the assigned basket shows the details on the front being the 2 items that are required for JF. He's due back at 1:31 that day, and you can see the notes on there saying that the spacer is still required. The basket goes up to the dispensary just as it does today and waits for the pharmacist or tech to dispense the scripts. And once you dispense the scripts using your dispensary software, just like you do today, once you've finished dispensing it, the basket updates to indicate it's waiting to be checked. And in this example, the person is checking the item not by going back into the MedView Flow, but pressing the buttons on the top of the label to see the details of this order. So they can see there the person's name and address, which we hide from the front page for privacy reasons, and they can see that there's 2 items. If they press it again, they can actually see the detail of each script in that basket, the directions and the QR code if they wanted to scan that into the dispensary and dispense it. So all the information they need to do a quick check is available on the basket. Once they've done that step, they can press the other button on the top of the basket to tell the workflow that it's ready for collection. So they didn't go back into the software to do the checking, they just did it using the tag. Once they've put it onto the shelf, the same thing happens as before. The software sends the SMS back to the patient to say the script's on the shelf waiting for them. They can come in, scan the code. In this case, when they do that, it's green. There's no impediment to hand it out, so the item starts flashing green. The system can go pick up the basket without going to the pharmacist and hand it out. And again, once that's happened and the basket's clear and empty, it resets itself waiting for its next piece of work. So that is the new concept of the MedView Flow Digital Basket. We are ready to begin some store pilots next month, and we now have the innovation patent lodged. Based on your feedback over the next few days, we'll be in market later this year, or maybe never. We'll see. Remember, any pharmacy can use MedView Flow and digital baskets, regardless of what dispensing system they have. So again, I ask you to come past the MedView stand in the trade show and please give us some feedback on this innovation. If you want to be involved in the pilot, please let us know as well. So to conclude our session today, we jumped ahead. To conclude our session today, there's no doubt the AI use will grow in pharmacy and it will improve customer service. As Reg said, careful choice about what tools you use and when you use them are very important as this technology develops. Keep your eyes out for what's coming, and there's no doubt there's exciting and rapid change in this area. But you don't have to wait for AI to solve all your customer challenges. You can serve your customers better today by simply choosing the best-of-breed technologies from companies who have commitments to standards that are based on secure and safe APIs. As I said, come and say hi to us at the MedView Flow stand or the Fred stand, have a look at our other innovations. Can I thank Reg for her assistance today, and for everybody, have a great APP conference. Thank you.